So we're going to do the tick section next because we have Dr. Angela Pelzel-McCluskey here to help answer questions if there are any. And I'm going to go ahead and lead working through this section. Just to clarify, the lameness section that we've got in, that was a priority in our needs assessment, that we get the prevalence of owner-reported lameness and the management of those lamenesses. The tick section was actually one that we were, Angela wasn't surprised, but the rest of us were, that it was a priority in the needs assessment that we try to learn more about ticks and horses. So this particular section of the questionnaire is oriented generally toward premises level observations. And so the goal is to try to describe what owners do related to observation for ticks. How often do they check their equine for ticks? So there's a leading question about whether they check for ticks. If they don't, then there's a skip because they're not going to have any information in the subsequent questions about how often they observe ticks, where on their equine they observe ticks, for instance. According to the Angela Pelzel-McCluskey and Angela James, this is data that's really not available in the literature on a national or regional basis. What do equine owners do and what do they observe? So as we move through the sections, as we get, say, to question 6, it's going to ask the most common location that owners found ticks on their equine. We ask about whether they had identification of those ticks done and how that identification was done. So the first questions in this section ahead of the D11 relate to them checking equine for ticks, frequency of observation of ticks, locations, and whether any were identified. From question 11 on, they could have had equine with tick-borne diseases, and this is owner reported, never having seen a tick on their equine. So everyone would answer this question, whether they had any equine with the listed diseases. And this really relates to the instructions I gave earlier that we want you to read the listed diseases. Because in reading the list that goes with this question, they might say, no, we didn't have any, and then as you read the list, they say, oh yeah, I had one equine with that particular disease. The other thing in this section is a time frame. So we wanted to capture a more recent time frame, and then we wanted to ask about in the previous 5 years. So that relates to D12. So they may not have had any in a more recent time frame, but they did in a more distant time frame. We also want to get an idea of the time periods when ticks were observed and the level of infestation. Another thing, they may use tick control products, even if they haven't observed any ticks on their equine. Maybe that's why they haven't found any, and what products they would be using and other prevention strategies that they may have in place. So those really relate to D15, 17. Then we asked a question about exposure to tick habitats. That's D18. And that's where the colored list of habitats that comes with the questionnaire can be referred to. We worked very hard to create text and photos that describe those habitats related to the potential choices on the questionnaire. So it'll be important to refer to the tick habitat list that you'll get with the questionnaire when you're addressing D18. We also ask if they've done any landscape modification, D20, related to tick control. And then the last question in this section that those that are involved in the ecology of ticks are very interested in is where do equine people get information about ticks? So based on our findings in the study, how can we get more information out to people where are the sources of information that they use. So those are the highlights of this section. They're really oriented toward whether the owners checked for ticks, whether they had identified any questions related to the ticks that were found, location, and whatnot, and then what mitigations they do for ticks, and whether there had been any observed tick-borne diseases. And we also, under the disease section, asked how the diagnosis was made. Acknowledging that the diagnosis of some of the tick-borne diseases is controversial, just as it is in humans, we wanted to know a little bit more how the diagnosis was reached. So with that overview on the tick section, I think it's relatively straightforward. Even for operations, say a boarding facility where the person answering the questions is the owner of the facility, we felt at the facility level that this section could be answered for most of the operation level responses. We are planning to have a tick training module ready in the near future. The two Angelas are going to be recording that in the near future. It's not currently on the NAHMS site, but I've seen the preliminary version of it, and it looks really exciting and has some great information in it. So with that, Daniel, we want to go ahead and hit pound 2 if anyone has any questions or comments on the tick section, and I'd like to try to get those while Angela is still here. So pound 2 or type in a question or comment on the tick section.
And we have received a caller with their hand up, going out to the line.
Thank you, Tim. I understand Daniel left.
Hi, this is Lynn Tobias. I just had a question about the skip that we have where we go, if they say they don't check for ticks, to go into question 11. Just as a horse owner, I don't check for ticks, but I will come across ticks. And if I say I don't check for ticks, but then I wouldn't write where I found them and things like that. So, you know, you'll lose that information that people don't regularly check ticks. You know, have a performance of a check. So
yeah, that's a really good point, Lynn. And yeah, this is Angela. That's a really good point. So if you get the feeling, based on the habitat you're in and the fact that you've got horses that are going to be turned out in pasture, that are going to be trail ridden, if you as the VMO attending the visit get the feeling that, you know, they may not specifically be checking for ticks, but during their grooming processes, perhaps they might come across them, then go ahead and maybe probe a little bit into those next 1 or 2 questions just to see if that plays out for you. Certainly that's an allowable thing, and in walking on a premises and seeing what the horses are used for and where they're kept, you're very likely to get some ideas about whether or not during their normal use, turnout, riding through the trails, whether they may actually, I mean, these are your areas where you keep horses and know other people in that area, so you may have some ideas that you're in an area where ticks are found and where ticks are likely to be on horses. So don't be afraid to go ahead and probe a little further, even if that initial answer is, no, I don't specifically check my horse for ticks. We don't mind you going ahead with questions 2 and 3 at that point to maybe see if that plays out. And if it doesn't, you can go ahead and then leave this portion.
Yeah, I mean, I've already pulled ticks off my horse in March. So in Virginia, we have a lot of ticks. So and it's a concern here. So I think we would lose valuable information if we don't probe a little bit.
Yeah, I think that's a really good point, and perhaps we should skip to, if they say, do you check for your equines for ticks, and they say no, maybe it wouldn't hurt to skip to question 4 instead of to number 11 and say, well, have you ever observed any ticks on your equine? They can then again say no and then skip to 11. What do you think of that? I think if you look at question 13, It says in the previous 12 months were ticks ever observed on your equine during the following time period. So I think that the skip works, because we really wanted in that first section to get if they checked for ticks and how they did it. And here I think we're saying, oh, well, I don't really check, but I came across them. So I think we'll still have some data on whether they observe ticks. We may not have the very granular detail. So I agree with Angela. I think, we certainly can probe, because they may not consider it checking that they came across them, but we also would capture that again, I think, in question 13. Thank you, Lynn, for that comment.
You're welcome.
Anybody else on the tick section? And I would empower everyone that goes through the manual, as you come across things, if you have a question prior to doing visits or after the first 1 or 2 visits, we learn through these things. This particular questionnaire has never been administered in NAHMS. We certainly did pre-tests of the questionnaire to try to assure ourselves that it worked as best we could, but we can certainly send out a blast if we're finding a particular problem, not a problem, but issue as we move through, to try to refine that a bit more.
If you have a question, please push the
Pound 2.
Some of the guests I cannot see their written questions because of the way they're logged in. So pound 2 if you have a question.
We'll wait just a minute more.
We did receive one caller joining the line. Bonnie Boone, your line is now open.
Yeah, I had a question about number 10, what type of ticks were found on the equine? Because a lot of people, they can recognize it if they saw it maybe, but they might not know its name. So is there going to be like a little visual, picture categories of these ticks to help them identify them?
That's a good question. We are going to provide an info sheet that's still in process, that's going to go out with their tick report. So this is more going to the tick scratching and biologics part. And it does have photographs of the ticks and their common name and scientific names. I don't think that we were planning to provide that as part of the questionnaire. But if that's a strong recommendation, I guess looking through the images, it would be difficult for me to pick them out from the pictures, but Angela's going to answer.
Yeah, so Bonnie, it's a really good point, and we talked about this extensively, but really there's only a couple of ticks on this list that you could, with the naked eye, visually identify in your hand. And I would say Lone Star tick is one of those, and the soft tick, Otobius, the ear tick, is going to be another one. The rest of them, you really have to have a hand lens or a microscope to differentiate the mouth parts and the head shape of these ticks. And so we really don't want to get off into an exercise in which people are self-identifying things that really they don't have the qualifications to do. What we were after here is if they had a qualified entomologist, extension agent, some other knowledgeable individual who helped personally identify the ticks, or they were sent into a laboratory where the appropriate identification could be done, then that's really what we're after here. And if they're not able to do that, then that's okay. We really don't expect a lot of people to really know what they saw, except in those couple of cases where they're completely obvious, because there's a white spot on the male right in the middle, that sort of issue. Again, they would not have probably been able to identify the female of the species, so we're going to be missing that portion if we allowed them to visually attempt to ID all of these, which they really can't do.
Okay.
Any other ticky questions, comments? We appreciate that. Angela's very proud, the two Angelas, Angela James couldn't be here today, are very proud of this section, and they're very proud of the tick exam and tick collection and ID that's part of the biologics. I think this is one of the exciting parts of the study that's really never been done before.
The good news is, and this might be a selling point when you discuss with them, you know, if they do take part in the tick examination as part of the biologics, then any ticks found, we will have them ID for them, and so they're going to have an actual report of what ticks were found on that day on their premises for future reference. So this might be something where when you get to this question, if they hadn't agreed or hadn't thought of participating in the tick examination part, this might be a place where they could actually get identification for the future.
Yeah, and we'll talk more about the tick scratching exam and the tick collection and ID during the March 30th webinar. And again, it is mentioned in that info sheet that was provided by NAHMS that that exam and ID was one of the incentives for participation. Anything else on the tick section?
And at this time, there are no callers in the queue.